I'm Dr. Lana Rivolo-Grasser, aka Dr. Ruby, and today I'm excited to talk to you about the Momnibus Act. The Momnibus Act goes by a few different names, so you may have heard of it called the Black Maternal Health Momnibus Act, and if you're in the state of Michigan, like we are, you may have heard of the Michigan Momnibus Act. These pieces of federal and state legislation are working to address the maternal health care crisis in the United States. Did you know that the United States is the only developed nation where our maternal mortality and morbidity rates are actually increasing instead of decreasing? And did you know that maternal mortality and morbidity affect Black individuals and other non-white individuals, particularly Hispanic and Latin individuals, at rates far greater than white individuals? This is despite socioeconomic status, area of living, and is purely based on the social consequences and the health consequences of systemic racism in our country. But did you know that 80% of these deaths and of the complications in the postpartum period could be prevented? There are solutions that can improve maternal health for all of us, and those solutions would be supported by the Momnibus legislation. Why are we using the term Momnibus? Well, it's a play on the word omnibus, which essentially means a package of bills. By packaging different pieces of legislation together, we can help pass a number of laws that would all be focused on a specific cause, in this case, maternal health. So what does the Momnibus legislation do? The Momnibus legislation does multiple things to improve maternal health. This includes supporting education of Black, Indigenous, and other persons of color in medical professions and in other professions related to maternal care and support for caregivers and their children. Why is that so important? Well, we know that care can be improved when there are shared identities between providers and patients. So expanding our workforce to be more diverse and representative of our US population can help ensure that everyone has a provider they feel safe and comfortable with. The Momnibus Act also includes legislation to help improve healthcare of veterans through the Veterans Administration and improve maternal care in these settings. Again, the Momnibus Act works for all of us. This act also includes legislation that would fund grants to support community-based initiatives, supporting moms and their infants before, during, and after birth. This would benefit programs in our Detroit community, for example, organizations like Brilliant Detroit, Wayne Pediatrics, the Community Health Clinic, the Children's Foundation, and other organizations could all potentially benefit from this legislation. So what can you do? You can contact your senators and representatives at the US federal level and ask them to co-sponsor the Momnibus Act and to vote yes when the Momnibus or components from the Momnibus Act are passed to the floor for a vote. You can read more about the Momnibus legislation, why it's needed, what it can do, and what other alternative strategies are available to reducing maternal mortality and morbidity in the United States by reading the policy brief my friend and colleague Simi and I have written together. We'll link it below. We'll also include more resources on the Momnibus legislation and help you to take action. Thanks for taking action to help not only ourselves, but others in our community stay resilient. And we hope you stay resilient too.